With rising cases of kidney diseases, especially due to lifestyle habits, it's crucial to spread awareness about prevention and early detection. Today, we are privileged to have with us one of the most renowned nephrologists from our city, Durgapur, Dr. Deepak Kumar. Welcome, doctor. What message would you like to give on World Kidney Day?
This year, the theme is detect early so that we can protect the kidney early. And this is the theme. How to detect early is only one way, regular checkups. If you are the high-risk patient, if you are obese, you are diabetic, you are hypertensive, or having any family history of kidney disease, at least annual checkup is mandatory so that you can get your kidney health scores with you and discuss with your doctor, and so that the early preventive measures can be started so that you don't get any major complications related to kidney disease. And again, the same thing, nutrition, healthy diet, good and regular exercise, minimize your smoking habit, avoid heavy alcohol consumption, limit your painkillers, unregulated herbal medications. This should be totally abandoned.
Dr. Deepak Kumar, do kidney diseases affect only the elderly or can they happen to anyone?
No, as we all know, the kidney patients is more prevalent in the older age group, but the young patient is not spared. But yes, the different types, the disease, there are different category of disease in young patients, like family glomerular disease, stone disease, and some traumatic kidney injury, or structural anomalies do occur since birth. There are some vascular diseases that are more common in young patients, and these diseases come in picture well from third decade onwards. The young patients do have a risk of kidney disease, and depending upon their other risk factors.
Dr. Deepak Kumar, how is changing lifestyle affecting kidney health?
We have a very sedentary lifestyle nowadays, taking long hours. These things ultimately lead to the reduced circulation, metabolism by taking long hours. That may lead to obesity, increase your blood pressure, even your sugar control. That will indirectly affect your kidney health. One of the important factors is sedentary lifestyle. The other thing we have already discussed with you, high salt intake in our diet, the high sugar and junk food we used to consume, that ultimately leads to poor diabetic control and obesity, increasing blood pressure.
Dr. Deepak Kumar, my question to you is, what impact do salt and protein have on kidney health?
We all, as an Indian, we eat salt too much, and the high salt is not good for kidney. As you know, high salt increase your blood pressure, and that leads to the damage the kidney vessels and increased proteinuria, and they ultimately lead to kidney damage. And the increased salt also increase your calcium load in kidney and may be responsible for calcium stones also. By taking too much salt, a lot of your BP medicine may not work properly and they will maybe ineffective. So indirectly it also leads to it may harm your kidney.
Dr. Deepak Kumar, what habits should we adopt to keep our kidneys healthy?
The fitness is a main, nowadays we have the good news, we all are more aware about our health. If we do the exercise on regular basis, you should be very choosy on your diet, the low salt, the low fat, the low sugar diet should be your choice in your diet so that your metabolism gets properly controlled. The regular checkup of blood pressures and sugar, because these hypertension and diabetes are two important factors that ultimately lead to kidney disease. And keep yourself hydrated, especially in the summer.
Dr. Deepak Kumar, how is changing lifestyle affecting kidney health?
We have a very sedentary lifestyle nowadays, taking long hours. These things ultimately lead to the reduced circulation, metabolism by taking long hours. That may lead to obesity, increase your blood pressure, even your sugar control. That will indirectly affect your kidney health. One of the important factors is sedentary lifestyle. The other thing we have already discussed with you, high salt intake in our diet, the high sugar and junk food we used to consume, that ultimately leads to poor diabetic control and obesity, increasing blood pressure.
Thank you, Dr. Deepak Kumar, for sharing your expertise with us today. Dr. Deepak Kumar, my question to you is, what impact do salt and protein have on kidney health?
We all, as an Indian, we eat salt too much, and the high salt is not good for kidney. As you know, high salt increase your blood pressure, and that leads to the damage the kidney vessels and the increased proteinuria, and they ultimately leads to kidney damage. And the increased salt also increase your calcium load in kidney and may be responsible for calcium stones also. By taking too much salt, a lot of your BP medicine may not work properly and they will maybe ineffective. So indirectly it also leads to it may harm your kidney.
Thank you, Dr. Deepak Kumar, for sharing your expertise with us today.
a public awareness initiative from the makers of Zeblong and Zeblong Tea.